So it's a troubleshooting, step-by-step manual. I have gone out of my way to leave no stone unturned here. So I hope that I've covered as much as most of you need to be able to get to your doctor's office saying, hey, I want to do stuff in this book, whether it's
Mm-hmm.
nutrition, sleep management, stress management, exercise, intermittent fasting, changing my medications, doing certain tests, having a better conversation with your doctor so that you get the care you deserve.
Yeah, I love that. Welcome to the Protecting Your Nest podcast. Are you tired of managing diabetes with medications, procedures, and surgeries in the conventional model of healthcare? There is another way to not only improve health conditions like diabetes, but to put type 2 diabetes into complete remission and reverse it. With the right approach, even type 1 diabetes can be managed to the point where your A1C is in the normal range. The key to this success lies in reducing carbs, which ultimately leads to improved metabolic health. Today, I want to offer you a valuable resource that can help you and your family take control of a diabetes diagnosis. That resource is a book entitled Turnaround Diabetes, the step-by-step guide to navigate type 2 and type 1 diabetes with less medicine. And that book was written by today's guest, Dr. Roshani Sanghani. Dr. Roshani Sanghani is the founder of Reisaan Health and a super specialist in hormone imbalance in patients with type 1 and type 2 diabetes. She is an American board certified endocrinology, diabetes, and metabolism specialist. In her private telemedicine practice, she teaches patients in India and in America how to change behaviors and habits to address what I call so-called chronic health conditions so that we can get to the root to them and hopefully reverse them. She's been a guest on the podcast in the past. I'll make sure to share a link to that. But in particular, I'm going to share a link to her wonderful book. And if I were you, I would pause this podcast right now and go to Amazon and get that book, because there are so many people that you already know, friends, family, associates, who are thinking that diabetes is not reversible, and they think the type 1s can't get normal diabetes, but that's just not true. And we need resources, and we need you to help us share this healing message. So with that, my friend, I welcome you to the podcast.
Thank you, Tony. It's been so good to talk to you again and catch up. And I'm looking forward to seeing you in August as well. So thank you for having me.
Absolutely. And for those who are wondering what's happening in August, well, the Symposium for Metabolic Health has wonderful conferences twice a year. The one I tend to go to is in San Diego because I think I should be living there. And we're both going to be privileged to speak there. And I'm really looking forward to, just being with you in person. Hopefully, maybe when you come to Chicago, since we both have roots in Chicago, we both have roots in the same health system, which is called Advocate Health. And we are really desperate to really encourage our colleagues that this is the path. The path is to understand the root cause and to help people heal. So I really appreciate your work. I mean, not just going to conferences and interacting with your patients virtually. I just think we have to put things in front of people, because this grassroots effort is going to require that sometimes a patient comes to the doctor and say, hey, doc, had you not heard of this? Just like Dr. Eric Westman had to learn about low carb from patients, right? And many of us have as well. So I really appreciate you. And today I really want to take time to help people understand, if they purchase your book, what they would get from it, and just understand the value of that resource. So let's start first by asking a simple question. Why in the heck did you write this book, and what can people expect from it if they read it?
Thank you, Tony. That's a great question because writing a book, I had no idea would be so tough. I thought patient care and becoming a doctor was tough, but when you try to write something down with clarity so that no matter who reads it, they get the clear message through and through without confusion, and you're not there standing next to them explaining exactly what you meant. Whew, it took a lot of cleaning up my own thoughts and decluttering and organizing myself to present to you, the reader, what I was trying to say. And what I'm trying to do with this book for you all is anybody who's been impacted by diabetes deserves to know what's going on in their body enough to be able to have a better discussion with their physician. This book does not replace any treatment with your doctor. You need to use this book in coordination with your physician. But there's a lot in here. Even if you stopped studying biology after like eighth grade and you dropped the subject, you still deserve to know this much, whether it's part one, which is the science about what is glucose, what is
Mhm.
diabetes,
Right.
what is insulin. Most of
Hmm.
us don't really understand these words. We say them, um, but I've tried to make it 10-year-old level, difficult
Mm.
science. Diabetes is something, to be honest, Tony, a lot of doctors don't understand the root problem of type 2 versus type 1
Hmm.
diabetes, how they're different, um, and how treating insulin resistance. We'll get to that, I'm sure, in a few minutes, but a lot of physicians don't understand what it means to treat diabetes as a glucose problem versus an insulin
Hmm.
problem. So I spend a lot of the book talking, early parts of the book talking about that. But the main part is not the difficult science or the overwhelming stuff. The meat of this book is help you navigate your life.
Hmm.
There are real problems in there, real people went through. It's not just your book saying, do this, 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 and this, and your diabetes will be fine. It's not that. It's There is fact in there about these are the things that can help, but I also bring you the problems you might face, the reasons why it may not have worked for you in the past, how to overcome each and every one of those. So it's a
Mm.
troubleshooting step by step manual. I have gone out of my way to leave no stone unturned here. So I hope that I've covered as much as most of you need to be able to get to your doctor's office saying, hey, I want to do stuff in this book, whether it's
Hmm.
nutrition, sleep management, stress management, exercise, intermittent fasting, changing my medications, doing certain tests, having a better conversation with your doctor so that you get the care you deserve.
Yeah, I love that, and I think the part I love the most is when I was on the low carb cruise. I had a chance to interact with Dr. Ben Bickman, and he's very, he's a PhD. He knows he can get into the weeds. He certainly knows how to simplify things, but I'm not really speaking to the Dr. Ben Bickmans of the world. I'm speaking to that 70-year-old, grandma who's
Yes.
trying to, not take as many medicine. And although we want to be able to speak to both audiences, I want to make sure everybody who hears my voice, and in your case, hear your voice, understands what we're saying. Because that's so important that people understand the why I'm going to make these changes, and why maybe the other approach wasn't the way that will help me heal. So please, so continue to spread the message that way. I think that's so critical. Um, One of the simplifying concepts that we understand is there's a benefit to low carb. And so I think in simple language, maybe I can ask you this question, why low carb as the best way to heal, particularly um, where you live in India, where you have a lot of plant-based dietary patterns where it tends to maybe be low fat instead. But tell
Mhm.
me your thoughts on why you think low carb is helpful for most people for diabetes.
Well, the book starts with the case of a man who taught me or made me open my eyes big and wide to the possibilities with low carb. I learned it from my patient as well.
Hmm.
And you mentioned two huge names in our field, two big rocks of Eric Westman
Yes.
and Ben Bickman. And I'm lucky and blessed to say I've had the opportunity to have both of those scientists review this book and put in their
Nice.
praise quotes
Yes.
for the book. So you will see their names in the book in favor of this material for
Yes.
the reader.
Yes. I saw
And
that.
yeah, thank you. And thank you for getting your copy also.
Okay. Yes. Right. Right. No
Yes.
doubt.
Yeah. So how low carb came into my life was almost by accident. I had these like isolated buckets of knowledge in my head. As an
Hmm.
endocrinologist, I was already teaching my patients with type 1 diabetes something like carbohydrate counting, which meant the more carbs you eat, the more insulin I'm going to give you for that meal. It was really simple.
Mm-hmm.
It was math. But we only used it in type 1. We were only saying your insulin dose depends on your carbohydrates of the meal. And it was not spreading into all of healthcare. It was not spreading into type 2. It was not spreading into obesity, into PCOS. We were
Mm-hmm.
not helping people understand carbohydrates in other fields of medicine. So there was this isolated type 1 management I had. And before moving to India in 2011, I was at Christ at your place. We were working in the same system. And I had been exposed to diabetes educators at UIC, at Cook County, where I did residency, and at
Mm-hmm.
Christ. So I always interacted with the diabetes educators because I've always been interested in the behavioral aspects of diabetes. So I was
Mm-hmm.
curious. I would sit in on their classes, and they would be sort of weirded out as, why is a doctor sitting in on these classes?
Right.
But they were kind and they let me stay. And I learned there about carbohydrate exchanges and how in the CDE textbook, I learned to become a CDE before moving to India, so I could do this for my patients when I moved, and I wouldn't have a sort of cultural not knowing what's going on in India because I'd been out of the country for
Mm-hmm.
10 years. So I
Mm.
thought by being an educator, I would connect to what their problems are. And I knew from that knowledge bucket that reducing carbohydrates can reduce glucose. So it's sad that reducing carbohydrates can reduce glucose, and insulin dosing is adjusted for glucose or for carbs.
Mm-hmm.
But these two data points were not connected
Mm.
in all of my patients
Mm.
until this man showed up. And this man, he taught me, he just didn't want to go on insulin. He had uncontrolled type 2 diabetes, and he said, no way, I'm going on insulin. I'll do anything else. And so that's when my two ideas had to smash together is I'm supposed to put him on insulin. He's not willing. But if he would reduce his carbs, I might be able to reduce his need for insulin. This sort of equation just sort of happened in my head because
That's
I
right.
wanted to work with him. And so
That's right.
I saw the power right there, low carb. We were able to avoid insulin and get him from 5 tablets down to one.
With this certified diabetes education, CDE, you said that you found that that was the key, but did any of that become clear during that education?
No. So
Yeah.
I no, no. Sorry, it happened
Yeah.
at the patient bedside. At the patient
Right.
side.
That's crazy.
It was
Yeah.
not. It was not in the classroom. No.
So Houston, we have a problem. So I intentionally said that because
Yeah.
even my lovely wife Karan was like, since you're in this space, why not just get certified? And I even thought about that. I ended up getting most of my education via the Nutrition Network. And for those who haven't heard of that wonderful organization, if you need a low carb education, whether you're a clinician or a layperson, Nutrition Network would be one of the outstanding places to go. But I just found that even when I got my master's in nutrition and functional medicine, there's this disconnect between this beautifully shared biochemical knowledge and all of that good stuff, but this disconnect between um, these basic concepts. And although obviously a master's in nutrition focuses on nutrition, there's still this strong lean towards um, plant based,
Mm-hmm.
and it's okay to be plant based, but there's no discussion about a low carb version of that. So it's
Right.
just so we have a lot of work to do, guys, because the people being educated, whether it's a diabetic educator or a clinician, or even the people in the world of nutrition, they're still being taught in a way that's not serving this conversation. So we
Yes.
still that's why your book, again, pause the podcast. We need resources that's going to
Yeah.
help at least expand your brain. So even if you decide to do something else, you now know I heard that argument. It's like
Mm-hmm.
politics. I listen to the conservatives, I listen to the Democrats, and then
Right.
I can, and maybe even the independents, and then I can say, okay, now I can kind of see where I land, and I can respect their perspectives as well as the ones I decide to go with. So I appreciate that. I just wanted to simplify it to that level. And one really quick question before we go into your book is the rise of diabetes. With the knowledge that we now have, it should be going down substantially.
Yeah.
But I think that, again, a lot of people don't understand the basic concept. So why do you think the rise is still continuing?
Right. Yeah, you're so right on that. And sad that the epidemic is getting worse. It's projected to keep growing. We don't see any promising projections coming from anywhere. But I do have hope that stuff like what you and I are trying to do and the Metabolic Health Symposium in San Diego, where Dr. Ben Bickman, Dr. Eric West, Jason Fung, there's so many, it's like Tro. There's so many of us trying to fight this fight, and we'll
That's
all
right.
come together. And I mean, I'm sure there's too many names. I'll spend an hour if I try
Oh
to list
yeah.
all the names,
Oh yeah.
but we're still small compared to the amount of lack of knowledge in
That's
this
right.
world. And there's lack of knowledge in something as basic as label reading. How do you read nutrition labels? If we're not
Hmm.
cooking at home, we're buying something ready to eat. Do we know how to even read a label? Are we even nutrition label literate?
Right.
Okay, and there's a movement happening in India that's going really viral. There's an influencer who's got a very big impact on teaching people to label read, and it's in Hindi, but it's
Mm.
working. He's getting attention. He's already fought off a lawsuit, and I think in this day and age, if you're getting a
Mm.
lawsuit, you're doing something right,
That's
maybe,
right.
you know. But he we managed to win, and he was able to get a powdered drink thing that was claiming to be healthy. He was able to
Hmm.
get them to have to take off the health claims because it had so much sugar.
Mm.
So label reading, in terms of people don't even know that if I switch from wheat to millets, I'm not really reducing my carbs. I might be low on gluten if I do that,
Hmm.
but
Hmm.
I'm not reducing my carbs. So people have misunderstandings. They have misunderstandings about protein. In India, we have so many of those. And like you mentioned about a lean towards plant versus not, I spend a lot of time in this book addressing those knowledge gaps, fears
That's
about
right.
protein, yeah, fears about animal based. And if you want to stay plant based, I show you in the book how to go low carb
That's
plant
right.
based.
That's
Okay,
right.
is you need to know for whatever
That's
choice of
right.
life you take, you deserve to know what your options are for better health with less medication. So
Yeah.
that's why nutrition is going. We've spent 40 years being told low fat, and so what did people do? They went high carb. When they went low
That's
fat, they
right.
went high
That's
carb.
right. That's right.
So that's in nutrition. In sleep, the world is sleep deprived. We live in a society that celebrates workaholism, that celebrates productivity,
That's
sometimes to the
right.
point of being toxic.
That's right.
And yeah, and I think Europe probably does a better job than India or the US in terms
Mm.
of boundaries.
Yeah.
Um, Maybe the pandemic taught us a little bit about work life balance, but we
That's
still
right.
have a problem with sleep. Even if we're not working long, we're consuming content, we're staring at gadgets late into the
That's right.
night, light pollution,
Yeah, we got to do
stress.
better.
We got to do better with sleep. And these are the four. We're coming to the four wheels, and so I'm sort of outlining. And stress management, we don't teach families, kids, how to learn to deal with negative emotions. We sort of are doing a
That's
lot of
right.
avoidance of it with
That's
consuming
right.
something, and exercise, I guess I could go on about that. And lack of it, a sedentary lifestyle. You have a
Hmm.
button to press to get everything on your phone. You don't need to go anywhere to do anything. And
Yeah.
I work from home. I can spend days without getting out of my house. Days.
That's right. Wow. That's
you
crazy,
know,
right?
it's crazy. It's crazy.
It's
How do you stay
crazy.
active if you're living inside four walls? It's
You
quite
just
difficult.
can't.
and
Yeah.
um, and this overabundance of food and no time restricted eating. So I think all
That's
of
right.
these are reasons for the epidemic that we're seeing in type 2
Yeah.
diabetes for sure.
That's right. And I'm fortunate because I live in a community outside of Chicago that is very active. So if I stood by my window, eventually I'll see somebody jog by. It's just guaranteed.
Mm.
So it's just, but in other neighborhoods, you can't jog, right?
Oh,
So
it
we
might
have
not be
to,
safe.
yeah, it
Yeah.
may not be safe. So that's why thinking about how to make the world more equitable, you have to say, okay, I see Miss Jones lives in a neighborhood where walking or jogging is not safe. And we know walking and jogging is healthy. So as a clinician, I'm like, well, let's problem solve. Where can we get those steps in so you can
Mm.
be healthier? Or what can we do in the house? Maybe we can use the bands and things like that. So you have to always be flexible. But I love the fact that you've looked at the big picture and you're trying to address everything. It's not just about reducing carbs. So I think
Yeah.
our audience is interested in hearing more. So let's look at your book. I saw it was kind of divided into maybe 10 parts or so.
Mhm.
And so that the audience will better understand what they are buying if they buy the book. Let's walk through the various parts at a high level so we know what we're looking for. So the first part one said the science, right?
Yes.
And and it's so important to understand, again, going back to what you said earlier, why am I doing this? What's some science? And
Yeah.
please keep it, I'm a fifth grader, keep it
Yeah.
simple. So how did you approach this chapter? Because we have truth be told, audience, there's so much low carb research. Going back to Dr. Eric Westman and others, I mean, he's been doing that stuff since 2002. So, but how did you approach it so that it was digestible and supports this way of eating?
Uh, I think I had to do it by force in my practice. Much before the book was a baby in my head, I had to do it at the bedside. After I learned my lesson from the gentleman in 2013-14, the last 10 years, I've been trying to bring stuff that I was seeing in the West to
Mm-hmm.
my Indian audience that there wasn't so much of YouTube. I don't think we were big on YouTube back then. I don't even
Mm-hmm.
know if I was big on
Right.
discovering science on YouTube 10 years
Right.
ago. But I didn't have such easy resources to say, go
Mm-hmm.
do this or go do that from the West. So I was digesting it and converting it into something my local Indian audience could do. And they might be fluent in English, or they might be fluent in another Indian language. And whatever
Mm-hmm.
languages I can get away with three Indian languages,
Mm-hmm.
but like just barely, at least diabetes related, I can talk in the
Right.
language. I might not
Right.
be able to get my way around a train station in all of those, but but I can talk diabetes. And so I had to simplify it because I needed the message to reach them. And I had just, when
Mm-hmm.
I discovered it with Dinesh, I name him Dinesh in the book. When I discovered it with him, I was like, this has to get to everybody. This has to.
Right.
So I'm not going to let literacy of any kind or language fluency of any kind get in the way. And honestly, I know that I have to get this book into multiple languages. So we have to
Mm-hmm.
keep it simple, so that people can receive it. So yeah, it had already been going on. So then I realized I've been saying this for years and years in my clinic.
Mm-hmm.
It needs to go into a book now, the science.
Wow. So the science was written in a simplistic way, so your patients can understand it. The people who buy the book can understand it. So I really appreciate that. So one of the biggest fears, and we've had some. I've recommended a few books with people I really respect, but I have had a few patients come back and say it's a little heavy for
Yes,
me. And I
technical.
would Yeah, and maybe even the diabetes solution would be a good example. A phenomenal book by one of the greats, particularly with type
Dr.
one,
Bernstein.
Dr.
Yeah, Dr.
Bernstein.
Bernstein.
He's
Yes.
his, but sometimes you need others to kind of simplify. That's why I appreciate Dr. Eric Westman doing a class with the Dykman family
Hmm.
to
Hmm.
talk about it. So I just think, but again, so we need that more academic. We got the book, the ketogenic, right? So,
Yes,
but we need
yes.
a little bit of both so we can kind of navigate that way. When I have questions, I can go to a text that helps me,
Yeah,
but I also need something that'll help my patients more directly. So that's part
exactly.
one, science. And then part 2 through 6 reminds me of something that's very familiar to my audience, which is my NEST acronym, right? And I want you to, but you said something with that group of parts that said
Yes.
lifestyle car, the lifestyle car. So what the heck is a lifestyle car?
Yeah, it was an analogy that came over time, and I describe how that analogy was born in the book, but I'll leak it out to you and your audience.
Okay.
Is it started off as I realized, so through the CDE I got to know about nutrition, and I realized that I don't know enough about exercise. So I went and got trained as a personal trainer. I knew that sleep and stress were also playing a role because being an endocrinologist, you end up I was working in a multi-specialty hospital all my life. So I had
Hmm.
colleagues from other departments. I had chest physicians, I had cardiologists. So we would go to common conferences and the word sleep apnea would pop up. So I started reading about that because it had endocrine implications. And I was like, oh my
Hmm.
God, There's such a role for sleep and hormones and diabetes,
That's right.
such a role for sleep and weight gain. So I was like very interested in the endocrine angle to sleep.
Mm.
And stress management came into my personal life through my own emotional personal crisis, where I
Hmm.
had to learn how to manage my own negative thoughts, negative feelings, so that I could be the best version of me in my daily life.
Hmm.
Um, so all these four were hovering around in my head, and I realized that nobody comes in saying, "I want to I want to fix my nutrition, sleep, stress management, or exercise." They don't
Right.
come in with these words.
No. No.
They come in saying, "I'm tired. I don't have
Hmm.
energy." And I was looking at it from energy point of view. And I'm a doctor
Hmm.
of metabolism. Our training is our fellowship is called Endocrinology, Diabetes, and Metabolism. I didn't
Hmm.
really respect the word metabolism when I graduated in 2009. I was like, yeah, metabolism. But when I started listening to patients saying, "I'm eating, I'm gaining weight, but I'm tired," I was like,
Right.
what's going on? Why are they
Hmm.
eating, gaining weight, and tired? What's going on with their energy management? What's going on with their
That's right.
metabolism? So I got curious about how can I help them have more energy. That was
Hmm.
my thing. I was trying to solve for.
Interesting.
Yeah. And so for energy, I was like, okay, four variables that can make you tired: nutrition, sleep, stress management, exercise.
No doubt.
I was like, do you think I could tell a tired person to exercise more? No, let's keep that last.
Right.
Because everybody says eat less, move more.
That's
But
right.
patients tell me I'm too tired to do that. So
That's right.
let's put that, yeah. So let's give you more energy first. So that came back to energy. I was like, okay, how do we give you energy? I was like, let's definitely fix what you're putting into the body, the fuel. Let's fix that. So nutrition was first. And I was like, if you get a good night's rest, you're going to have more energy. So I put sleep second.
That's right. I like that.
If you wake up and your day is full of stress, that's going to weigh you down. If you're stressed, it's going to backfire and it's going to affect your nutrition choices, your sleep choices. But if I fix nutrition and sleep first, your mood starts to improve. And we're starting to see that with metabolic psychiatry. Chris Palmer's book, Georgia Eads' book,
Hmm.
that metabolism of the brain can be affected. So stress management, I didn't want to tell people fix your stress management up front, because I realized by fixing
Right.
nutrition, fixing sleep, stress management starts to become more
That's
manageable,
right.
automatic.
That's right. Yeah.
I didn't realize that. I wasn't doing psychiatry on them. I wasn't doing neurology on them. I was doing
That's right.
endocrinology on them.
That's
The
right.
body is smarter, right? You're doing something that's going to affect the whole system.
Nice.
So stress management became third. And again, why
Cool.
did stress management come before exercise? Because if someone's really stressed, they're not going to really feel like exercising. If their mood's off, they're not, even though exercise is an antidepressant, natural endorphins, that's great. But if you're in a better mood, you're more likely to do it. So I
Yes.
figured give them this sequence: nutrition, sleep, stress management, exercise.
Nice.
Four things that were essential, because whenever I looked, and I have been doing this for like over 10 years, whenever I saw someone with any of these four out of way, things would fall
Hmm.
apart.
That's right.
So people doing the best diet, crazy exercise, but lots of stress and no sleep, like not enough sleep, they would be in trouble. So any which way. So then I started drawing a table in my desk.
Hmm.
I was sitting across the patient, physical office before, way before pandemic, and my prescription paper would have the stuff on the front, and I would flip it over and I would draw a table with four legs: nutrition, sleep, stress
Hmm.
management, exercise.
Hmm.
And I was like, if you have one shaky leg, it just takes one shaky leg for this table to become unstable.
That's right. That's right.
So I was like, okay. So I went with the lifestyle table for a while. It was a table, it was sitting
Hmm.
there as a static thing. And then I realized, just because your four legs of your table are good today doesn't mean they're going to be good 3 months from now. Something may happen
Hmm.
to you in the journey called life that will throw you off path, that'll set you on a detour. So I realized the table is showing stationary, static. It's not dynamic at all. There's no movement.
Hmm.
So I added the car analogy, four wheels of the car, because now you're navigating the ups and downs of life. There's
Mm.
detours, there's bad weather, there's potholes, there's traffic, there's irritations, unexpected delays, there's a view in
Hmm.
front of you, there's a rear view behind you, past, present, future. So many concepts that aligned with a moving vehicle where you're driving, you're in charge.
I like that. I like that. That's what I'm talking
And
about.
yeah, and then fasting.
Yeah.
So where did fasting fit? Part 6 of the book is on top is if your
Mm-hmm.
car is okay, you're tuned up, your four wheels are good, they've got air, there's no punctures, no flat tires. You want to go on a road trip, 3 days driving, you need good
Mm-hmm.
four wheels. Then you can think about putting suitcases on the top of the car, in the trunk, wherever you put the luggage, and go further. So
Nice.
if your metabolic health journey needs you to go further, that nutrition, sleep, stress management, exercise didn't get you all the way, fasting is the fifth option, fifth tool. So in the book, it's part 6 because we have the science as part 1, but it's nutrition, sleep, stress management, exercise, and fasting on top of a stable lifestyle car.
Nice. Um, I had not thought about the order. I think I thought about. I always knew nutrition was the most important thing because I've had people lose 100 pounds with no exercise.
Right.
But what I like is that you've reminded us that if we don't address the sleep and stress, you're going to have a problem. I have a very almost anal belief that I got to get enough sleep. Now, every once in a while, and we've learned this through our journey, there are times when you
Yeah.
gotta do what you gotta do. When we were in medical school and things like that,
Yeah.
you gotta. It's just not going to be there. But residency was horrible. I
Yes.
mean,
Yeah.
you're up all
Yeah.
night, But man, to the extent you can control it, um, getting the nutrition, then the sleep down, and then of course the stress makes sense to deal with those before exercise. And of course, fasting is optional, but it's huge. I mean, I just love not having to think about food because when I fast, I'm not hungry. And of course, if you're resting your pancreas, it's going to be happier, and it's going
Hmm.
to. And if you have the opportunity to restore it, and I think for most of us, you can. I just think that's wonderful as well. So I really think that that's a nice perspective. So hopefully, clinicians in particular hear your message because
Yes.
they need to understand that you are not a phenomenal doctor just because you got the diagnosis right. You're not a phenomenal doctor just because you gave the right medicine. Or even if because you recommended low carb, you're a phenomenal doctor because you're thinking about all of these factors that people struggle with. And if you help them through the struggle, now we can say this doctor and or pharmacist and or nutrition professional and or anybody who's a clinician has really helped the people who people thought couldn't be helped because somebody gave up on them because they thought they weren't motivated enough, or if they would just simply do what I say with this diet. It's our job to find those issues that are barriers, and
Exactly.
sometimes it's teaching them how to deal with their stress and how to improve their relationships and how to just be better at exercising in a way that's manageable for them. So I love all of that. Part 7 focuses on investigations and prescriptions. When I first saw the term investigations, I thought Nina Teicholz was going to show up in your book. As
I
you
mentioned
know,
her. I do
I'm sure
mention
you
her.
did.
Yeah.
You
Yeah.
do.
Yeah.
Okay, cool.
Yeah.
But I think the way you defined it when I looked at the book, and it was more about how do you measure where you are, investigate your current state. So let's talk a little bit about
Yeah.
what the focus of that part of the book was in terms of labs and prescriptions and things of that nature.
Right. So just like part 1 was to help you know what you need to know without having to go back to biology class,
Hmm.
part 7 and 8 are to help you know things without having to go to medical college.
Hmm.
Okay? Where if you live with diabetes, why should it be only your doctor who knows why you're getting certain tests done or why you're getting certain medications written for you?
Right.
Like
Right.
somebody who has diabetes but has normal blood pressure, why is a blood pressure medicine being written for you? Do you know
Right.
why?
Right.
So
That's right.
why are you putting it in your mouth? Right? Why are you signing up for these tests? I want you to know so that you are part of this decision making and you understand the results when they come in. It doesn't replace your doctor's role, of course, because there is a very important role for a clinician who's been seeing reports for 20 years, 10 years to look at the nuances. But at a basic level, I want you to have some understanding. I'm not okay with you being completely blind and just following things because I say so or because your
Yeah,
doctor says so. You deserve to
right.
have more knowledge, so I'm bringing it to you.
That's right. I love that. And there are so many, like you said, why would you put me on like an ACE inhibitor like lisinopril and I don't have a high blood pressure? I mean, I think those types of questions being answered are very helpful because, first of all, people don't want to take all these medicines. What we're trying to do is say it's okay to bridge you from where you are with medicines that have been proven in science to be of value. But what we're trying to say is that if you do the lifestyle changes, you may not need to get the protection of that ACE inhibitor for diabetes if you don't have diabetes anymore.
Right.
And you may not need the statin anymore if you have reduced the risk. The biggest risk is the diabetes being uncontrolled, causing all this
Exactly.
inflammation, right? So if we get rid of
Exactly.
diabetes, then maybe we don't need the statin. You know what I mean? So it's like, regardless of what you feel about these drugs,
Yeah.
the lifestyle will give you the path. And then you can look at your doctor who's not even necessarily like us and say, listen, my blood pressure is normal, my A1C is normal. And then you can, with a
Yeah.
straight face, say, you know what, I think I want
Yeah.
to take a different path. So I really
Exactly.
appreciate that as well. That's really wonderful. Um,
Yeah.
Now, with us being from the same health system, Advocate Health, in the Chicagoland area, we know that moving that needle is a challenge. Now, I'm still in that health system because my health system, your previous health system, they do listen, and it is physician led along with our advanced practice clinician colleagues. They do listen, but it is a big ship, right?
It
And
is.
so it's a lot to move. So part of my role is to give this message of healing to them if they are not aware. But also, my hope is that patients also know how to navigate the system. So,
Exactly.
when I looked at your part 8, which talked about doctors and hospitals, it kind of seemed to share messages of engagement. How do we connect with each other? So, talk a little bit about the purpose of that part of your book.
Yes. Thank you. That part was so that when people have to interact with doctors, again, beyond just what are the tests you're ordering, but it's not just your doctor who's trying to protect you from the diabetes complications onto your eyes, your feet, your kidneys, your heart. So I want you to come into those meetings as the reader, the person with diabetes, knowing your plan for how do
Hmm.
I want to protect my kidneys, my heart, my feet, my organs from diabetes, not just be a passive receiver of what the doctor has to say to me. So I'm trying to bring you to equal footing with you being the expert in you, having a more deeper conversation because, and I've actually put in there questions to ask your doctor topic wise, and that's in part 11, is under nutrition. These are the things you can ask. So how to start a conversation so that you can be the master of your car, your navigation system, your ship, whatever you want to say, your direction. Where do you want this to go? So in hospitals, because hospitals are strange places for patients. Although you and we've been commuting to hospitals for decades. Every day in
Hmm.
the morning, I got up and I commuted to a hospital for
Hmm.
20 years. So we take a lot of hospital-based information for granted. It's just part of my background noise. I know exactly what it is to be around a hospital environment. A person on the outside of a hospital, it's a crazy place. A
Yeah.
hospital is like, what is this place? And then you add diabetes to the mix, and it can get
Hmm.
really complicated. So I want people to be able to read this from the comfort of their homes. Um, so that if ever, God forbid, you do have to be in hospital, you know what your options are in your diabetes
Right.
care in
Mm.
hospital. Because
Mm.
you need to know a little bit. People watch TV shows like Scrubs and Grey's Anatomy, and there was that show that was based on Cook County, right? It was called ER.
That's right.
People love those shows about what happens inside hospitals, but I don't want to show you that. I want to show you what it is to manage diabetes in the hospital so that you know what you can
Yes.
talk about.
I am so grateful for that and for all the health systems out there that are doing their best. have these nutrition professionals who help, come up with the menus and things of that nature. But we still have a lot of work to do because many times my patients come back from the hospital and I ask them, so you weren't on insulin when you went into the hospital. They get
Yeah.
put you on, and now sometimes they take you off metformin because metformin can, increase your risk for, acidosis if you are getting, maybe a contrast dye procedure and in the hospital. So maybe we want to hold metformin and we got to control your sugars. But then you hear, if you peel the onion more, you'll realize that sometimes their diabetic plate was not really a diabetic plate.
Yeah.
A
And
lot
I
of
talk,
starchy
yeah,
foods. I'm sure you
exactly.
do.
Yeah, yeah.
So,
I talk about that. And what I've done is, see, I'm not here to pick fights with any
right.
organization
Me
or
neither.
yeah, or industry. I think they're big systems, whether you call it big hospitals, big pharma, big food, big whatever, big tech. I'm
Right.
here to empower the reader with what happens in those hospital trays and
That's right.
why
That's
it's
right.
raising your blood sugar so that you
Right.
have a say.
That's right. Just
Yeah,
open your mouth and say, "You know what? Thank you." And you, it's just like going to a restaurant, even as a patient, and you may have your insurance helping to pay for it. You're a consumer, and I. The only time it's so funny. I'm going to tell you when I went to school in New Orleans, and in New Orleans they're known for their food,
yeah.
and I always remember this chef coming to the table, and we go out, we tell them what's safe for us to eat. And in New Orleans, it's very difficult. And he just came to the table. He said, "Well, how dare you come to New Orleans and try to change the food?" I was like, "Wow."
Oh my
how
goodness.
how dare you? I was like, well, this is what's
Wow.
safe for my family. He was like, what's the point of coming to New Orleans? So, but my
Oh my
point
God.
is that you'd be surprised where you can change the menu
Yes.
and or adapt. I remember leaving a conference with my wife, and we were, at the airport, and we just simply went up to the McDonald's, and I ordered some patties, and he didn't flinch when I asked him, I just want patties. He didn't. So apparently other people have done
Oh,
that. But more
oh,
importantly, I used to get these bunless burgers, but now I'm more carnivore. And I tell you, it was really weird how it was just not expensive. It was like,
huh.
I don't know if it was 50 cents a patty, but it was very affordable. So I got like six
Okay.
patties for $3. And, so the key is when you're in the hospital, when you're in a restaurant, when you're at the airport, you'll have the knowledge to navigate. That doesn't mean that you don't have moments of indulgence. That's okay. On the low carb cruise, people had moments of indulgence. That's okay. But to not know that if I eat this way, which is starchier or sugar, more sugar, it's going to hurt me. I just want you to know, and then you decide what to do with that information. So thank you
Exactly.
for all of that too. I just think people need to be empowered. So thank you for that. Now, the part 9 was about women and children, and we are both familiar. When I saw that part and I looked through it, I was like, this reminds me of Professor Tim Noakes. How dare my friend? How dare Dr. Roshani have the courage to say out loud that maybe this dietary pattern is okay for children? I know with Professor Tim Noakes, when he did a tweet and said that it's okay for a breastfed baby
To be
to
low
be,
carb.
to be low carb. How dare
Yeah.
he say that? Now, thankfully,
Yeah.
he won the lawsuit. But
Yes.
so it takes courage to say this in a world that's still not there yet. So in that
Right.
chapter, why did you focus on women and children?
I needed to do women because there's so much insulin related changes that happens through a woman's life, whether it is PCOS, whether it is
Hmm.
pregnancy, whether it is menopause. While the entire book is relevant to both all genders, whichever way you identify, etc., the insulin bit is common to all people. But I had to make mention of the female reproductive system and how it changes through time at various stages of your age. Whether or not you choose pregnancy, not at all about that. But if you do or if you don't, how does insulin resistance and diabetes play out in a woman's life? I needed to
Hmm.
make special mention of that. Children, I added children. I say in the book also that I'm not a pediatrician. I'm not a pediatric
Mm-hmm.
endocrinologist. I'm not a
Mm-hmm.
child psychologist. I'm an adult. I treat adults. And I am lucky to be the mother of two amazing young teenage daughters.
Cool.
And raising them has been a blessing for us. And I cover children not so much from being prescriptive about what is the right amount of carbs for a child, what is the right amount of protein for a child. I sidestep that piece of it because I know that there would be pediatric nutrition folks who would
Right.
do a better job. What I did here was I was talking to the adults who have children. So, in a sense, I'm actually talking more about family dynamics. How do you
Mm-hmm.
talk to your child? How do you empower your child? How do you listen to your child? How do you communicate with your child who
Mm-hmm.
has diabetes? And how do you avoid power struggles with your child?
Mm-hmm.
How can you be a role model for your child? So, children with diabetes, especially if it's children with type 2 diabetes, sometimes parents ask is, well, fix it. And I'm like, but you do understand this has come from your home. I'm sorry, but how, it's not about blame. It's about flipping it to say, this is not the child by themselves going out and getting diabetes because of some
Mm-hmm.
bad behavior. This is the environment. I talk about DNA, I talk about nature, nurture, epigenetic influences, eating habits, all the lifestyle habits. So you can inherit things from your parents through DNA, and you can inherit things from your parents through habits.
Mm.
So the chapter is meant to empower the parent
Mm-hmm.
of a child, that what can the parent do to make it easier on the child?
Yeah, I love that. And I really appreciate that we focus in areas that are not as commonly focused. And so, therefore, I really hope that the children, the women are aware of those things. So now, the chapter that my wife will probably engage in the most is the last part, and that's because she suffers from type 1 diabetes. There is it's really amazing how that's underappreciated, not talked about often, and we have to do better. So from your perspective, I want to hear, you know, why did you decide to focus on type 1 diabetes? I know we refer people to endocrinologists with type 1, but again, people just don't bring up type 1 that often and they don't give that audience the right attention. So, what made you really decide to give a whole part of your book to that audience?
Oh, yeah. And Tony, I got advice to make a separate book for them. Don't put
Mm-hmm.
it with the type 2 people. And I was like, no, I'm not doing that. I'm keeping it as one book
Right.
because
Amen.
everything, yeah, thank you. Everybody with type 1 will benefit from the science, from the lifestyle car, from knowing your blood tests, your medications, from knowing how to deal with doctors in hospitals, from knowing
Mm-hmm.
what happens in women's health, from knowing how to deal with children. All of that stuff is relevant for the people with type 1. So I put it
Mm-hmm.
after all the important stuff, which the only major difference is going to be in terms of how you manage the insulin dosing. That's obviously very unique to people with type 1,
Mm-hmm.
and we have to address that. And so the lifestyle base was not something I was not giving my patients with type 1. I was heavily giving it to them because guess what? If you do those lifestyle changes, type 1 diabetes management becomes so much easier. This word
Yeah.
brittle diabetes is false. There's no such thing as brittle type 1. Brittle type 1 is a situation where the doctor and patient have not figured out how to match the lifestyle with the insulin. That's it.
Mm-hmm.
That's it. And
That's it.
so that's it. So we saw so many people with brittle diabetes with what they came in like that, or um, volatile type 1 diabetes, or they would be called, what were the other words? Fragile diabetes,
Mm-hmm.
or hypoglycemia unawareness, difficult topics
Mm.
where the person is very upset about, not going too high, not going too low every day, every day. And
Mm.
there are statistics. I think Stanford came out with an approximate that somebody with type 1 has to make around 350 decisions a day extra besides what everybody else lives
Wow.
with per day.
Wow. Per day. And that's what makes it hard for my wife as a pharmacist to get that diagnosis, because she knew in
Yeah,
that moment for the rest of her life, she's going to have to micromanage her life.
yeah,
So I do want to do a shout out to all the people
yeah.
who have to do that. For type 2s, there's a way to get away from having to do that, because you're going to always have to think about your food, but maybe you won't have to check yourself as much. For type 1s, they'll be doing that for the rest of their lives. We just want it to
Yes.
be easier, and we don't want them to be
Easier.
on that roller coaster, that
No,
up and
we
down
can do
roller
that.
coaster. Yes, we can
Yes,
do that. So
and they can live full, beautiful lives. They can do
that's
everything. They
right.
can, you've seen it. You've seen the Prime Minister of the UK. You've seen
That's right.
Wimbledon. You've seen Grand Slams. They're athletic. They're Olympics. They're everywhere. They're in acting. They're everywhere. So don't let
That's right.
anybody limit you. You can do things. Um, and there, I get a bit technical. Is how to empower you to have a better conversation with your doctor about your insulin plan.
Okay. All right.
And I think that the reader, if they understand that chapter, the reader with type 1, they are going to be possibly more qualified than the basic physician in type 1 management if they learn this chapter well.
Yeah. I'm almost positive that's true, because so many people um don't understand basic principles. These are clinicians now, like, oh, I actually have to worry about my protein when I think about my insulin, like simple concepts. And I'm always amazed that that's not really shared with people who are in your profession. You're kind of an outlier in that you see the world through a nutrition lens. And my experience with endocrinology has been, it's all about the medicine. It's all about the medicine. And it's like to the point where you don't even talk about diet in a way that it should be. So we really have a lot of work to do when it comes to making sure our clinical colleagues and of course our patients understand. So I'm going to take over the last few questions by handing it to my wife in terms of her thoughts, right? Since she's type
Yes.
1 and I want to honor type 1s, one of the things that she would ask, and she asked in the beginning, is, why would I get type 1 diabetes, and particularly latent onset? So you get this latent onset diabetes diagnosis later in life. Where did that
Yeah.
come from? What's your thoughts on that?
It's a tough one, LADA, LADA, latent autoimmune diabetes of adulthood, where
That's right.
it looks like the type 1 you see in kids, but it just
Mm-hmm.
happens later, like in your 30s, your 40s. I've seen it happen to someone in their 50s. And honestly, I don't know. I wish I knew. I'm not a researcher. I'm just a clinician helping people navigate the day to day. There is an autoimmune component to this. So the anti-GAD antibody, the GAD or the glutamic
Mm-hmm.
acid decarboxylase antibody, is the one we look for. But I've seen, sorry, I've got a drippy nose today.
Uh-oh,
Apologies.
sorry.
Yeah,
That's
I'm gonna,
okay.
maybe we can edit that out if it goes.
Yeah, okay, okay.
but but the anti-GAD antibody or anti-glutamic acid decarboxylase antibody is something we check for type 1 in adulthood. I
Mhm.
do see sometimes adults with antibody negative, so they don't have the GAD antibody, but everything else about them looks like LADA.
Okay,
They're
okay.
not overweight, they're not eating high carbs, they're not sedentary. They
Mhm,
haven't done any of the lifestyle things that gives people type 2 diabetes.
okay.
So we don't really know, except for when the antibody shows up positive, we can say, oh, it's autoimmune. Now, I don't know if I imagined it, and I haven't checked the research, but I did see what felt like a spike in new cases during the COVID pandemic, and I wonder
Mm,
if the any viral trigger does something to the immune system, like a very potent virus that might just do it. We've heard stories of someone saying, I got it after pancreatitis. I got it after
mhm.
pregnancy. Pregnancy is a time of major immune system changes. I've had two
That's
women
right.
who developed it through pregnancy, and they were normal before pregnancy. So something
Wow.
changing with your immunity
Yeah,
where it's auto attacking your pancreas,
that's right.
whether
That's right.
viral. So we don't know. I wish I knew, and I'm sure
Hmm.
research is going on to figure that one out.
Yeah, and the only other question in that space of type 1, have you heard anything about anything upcoming in terms of possible cures? You know, you hear about pancreas transplants, you hear about, you know, all kinds of stuff that's out there. Anything that
Yeah.
you've heard on the horizon?
Yeah, definitely islet cell transplant. I don't keep up with that literature. I'm so much on the lifestyle side, but this is what I
That's right.
hear in
That's
conversation
right.
is transplants as one, and also probably more exciting and more impactful. What I've been hearing about is screening people who might be at high risk. Sometimes this happens, boom, in somebody first time, like nobody in the family had it, and it just out of the blue,
Hmm.
it just shows
Right.
up in a what they call the first case, like the index
Hmm.
case,
That's right.
and then it starts to trickle into the family through the DNA. But um, there might be a role for screening people for
Hmm.
some DNA type of profile or antibody
Hmm.
type of profile, and catching that before the pancreas fails
Right.
while they're still making insulin, and putting
That's
them on
right.
some immune modifying therapy to stop the
Hmm.
auto attack and to stop the
Okay.
autoimmune destruction before it gets destroyed.
Excellent. Okay, that sounds like something that's
Yeah,
hopeful. Yeah.
yeah. So instead of trying to cure it once it's destroyed, maybe try and prevent it when you see a high risk person come in.
Right.
So I see that strategy is being looked into.
All right, cool. Well, thank you for that. And I'm definitely gonna, suggest to the audience, when you reduce the inflammation and have lifestyle changes. We don't have the randomized trial for this, but I can tell you it's very likely that you'll probably decrease your risk just by doing that. So
Yeah,
because when you think about autoimmune diseases, there's no better way to go than maybe a keto or even carnivore diet. So, feel
yeah.
free to just keep that in mind. And we can't, guarantee it, but I think you'll put yourself in a better spot. So as we wrap up, the first thing I want to ask you before I ask you how you plan to protect your nest, what any final messages you'd want to share with the audience today?
I put so much into this book, thinking about long-term impact. And I, especially still, it's just coming off of the conversation for type 1, what specific to type 1, and then I'll talk to the general, is I really do hope that this is right up there with Dr. Bernstein's book as one of the most powerful resources that can help the community of type 1 to
That's
have
right.
tools and solutions in their hands that they never got, or that they didn't know where to look, or they had it, but it was all over the place, all over the internet, and now
Hmm.
it's in
Hmm.
their hands. It's like at their
That's right.
fingertips.
That's right.
And then taking that to, and that's why I put type 1 on the cover. I took a lot of feedback when I made the subtitle, and some people saw that there's a praise quote by Jason Fung, and they assumed that this book is type 2 only. So I said,
Hmm.
I do not want that price to be paid. I need to let people with type 1 know this book is also very much for them. And so
That's
we
right.
made sure to put it in the subtitle so that nobody
That's right.
misses the chance to know about it.
That's right.
So
Yes.
my message to whoever's listening is, I pray this is the book that has impact on anyone with diabetes or likely to be impacted, or thinking about diabetes, how to prevent it, how to manage it with less medication. I pray this is the book that gives you what you need to turn things around.
Yeah, and I do believe that it will, having taken a look at it. And again, we need more resources. We should not be unusual. You shouldn't be one of the few endocrinologists in the world who understands this. This should be part of the basic education, and I think that until it is, we'll continue with our grassroots efforts to do that. So for those who are checking this out, it is really incumbent upon all of us to share this message. So I just think it's a great gift. You don't have to have diabetes yourself, but you know somebody. I
Yeah.
guarantee you. And imagine being the person who, just literally just handed a book to somebody and they actually read it. and then their lives change. And I just had a patient who I'll be releasing a video short on my YouTube channel. I know you have a YouTube channel, so I want to make sure you mention that. And it's just a testimonial. And in that video, the young lady, Miss Hood, said that she had, of course, reversed her type 2 diabetes, but her daughter, who was also eating with her, lost about 30 or 40 pounds. I mean, it's like,
Exactly.
wow. So imagine
Yeah.
being the person who helped somebody in your family or a friend lose 30 or 40 pounds, or get off of their insulin, or suppresses their appetite so much with low carb and keto that they don't have to worry about taking Ozempic or
Right.
Wegovy. So
Yes.
why not put them in that position of power, and not to mention all the side effects. I mean, metformin reduces your B12 level. So now you got to worry about your B12 level. Of course, it causes GI upset. We can talk about Ozempic all day and the potential side effects of it. I had a patient who had a bowel obstruction, and we're fairly convinced that her gastric motility that went down because of Ozempic was probably related to that led to that bowel obstruction. So why take those risks when we have very simple principles that we can learn in a podcast, in a book? So thank you so much. So as we wrap up, and we want to keep you around and healthy, what areas of your life are you focusing on over the next 12 months so you can protect your nest?
Gosh, since our last podcast and since my last conversation with you, this book took up a lot of my conscious time. And I skimped on sleep. I was not sleeping well because the book was running in my head, and I was like,
Mm-hmm.
there's a typo over here, and I need to put this
Right.
chapter over there, and this bullet needs to go there, and this reviewer hasn't yet gotten back to me. I need to follow up. So I was going nuts doing this book,
Mm-hmm.
and this sort of burden of trying to make it last beyond me, right? Like I need the book to
Mm.
be meaningful beyond my time on earth. So in that time, my sleep and my stress management went for a
Yeah.
toss. Okay.
Mm-hmm.
And I literally, I think that this cold that I'm dealing with right now is a reflection of that. I don't normally
Yeah.
fall sick, but it's a wake up call for me. My body's showing me the signs of a need for rest, a need for daily spiritual centering, and getting back to knowing that yes, you were supposed to do this book and it was supposed to come to the world through you, but it's not your book anymore. It's for the
Yeah.
world. Let it go. Let it take off and let it do what
That's
it
right.
does, and come back to you, your health, your nest, and center yourself again. So focusing on sleep and my spiritual daily practices, which have gone about a bit by the wayside, bringing those
Mm-hmm.
back.
Beautifully stated and well received. Really, last question is: was this? How did you publish with a publisher or self-publish?
Oh, I tried. I pitched to publishers for about 2 years in India
Mm-hmm.
and in the US, because those are the two
Mm-hmm.
countries and
That's
markets
right.
that I know.
Yeah.
And I didn't get any bites. I didn't get
Yeah.
any.
Yeah.
2 years of pitching. And so I finally took that as a message from the universe is, okay, I'm going to self-publish.
That's right.
And yeah, and I think angels, when they're looking out for you, they're looking out for you. And
Mm-hmm.
my interview with Tro on Low
Mm-hmm.
Carb MD caught the eye of Phil Ovadia.
Mm.
And I spoke to him on his podcast, and I asked him the same question. I was like, Phil,
That's right.
how did you publish your book? Because I had been dealing with this, rejection situation. And I said, Phil, you look like you self-published. How did you do that? And
Mm-hmm.
he helped me figure out the way, and he connected me
Right.
to a consultant. And that's
That's
how
right.
that's how I
That's right.
self-published. Yeah.
Yeah, I've talked to, because I'm working on an obesity book, and it in my first book, Fix Your Diet, Fix Your Diabetes, was self-published. So I'm actually, I think both ways work. Dr. Georgia E, she went with a publisher, but it is one thing that I've learned from talking to my colleagues is there's still a little pushback, and sometimes the publishers are not excited about this approach. But the reason why I asked that question is for my audience. Guys, this is a grassroots effort. So, in order to get this book out to more people, we need you to share it. And most of the marketing will probably be through this type of platform, where it's through a podcast and things like that. So let's help my colleague not get a cold. So she won't be stressed out, right?
Yes.
And get this out. And I can't understate how valuable this information is. I just can't understate it. So for those who are checking us out and made it to this part of the podcast, please take the opportunity to help spread this message, so that somebody will one day look at you and say, thank you. Thank you for exposing me to information that I had not received from my clinical team, because they were not exposed to that information. So I really appreciate you. I cherish you. Let's wrap up with you telling us how to get. We know Amazon has your book, but anything in terms of your YouTube channel, website, anything you want to share, your virtual medicine practice as well.
Yes, thank you. So before I do that, I would just, have a gratitude to people like you, people like my family, my immediate family that I live with, my husband, my daughters, my brother. They believed in me, my friends, close friends.
Mm-hmm.
They have believed in me, specifically, to back this book. And I want to make a shout out to them, because, like you said, it was grassroots. This has been family blood, sweat, and tears to get this book
Mm-hmm.
on the shelf. And so, thank you, Tony, for helping me share it with the world.
Yeah.
It means a lot.
Thank you.
So, where it can be found, my website is Reisaan Health. Ray, it rhymes with sunrise, sun rays, but it's spelled REI, Reisaan, SAAN. So it's REISAAN
Yeah.
health.com. And when you go there, I have the links for Amazon India, Amazon US, Amazon Global, because it is available through Amazon globally.
Mm-hmm.
And the Kindle version is also available. So we've got paperback, we've got hardcover, and we've got
Mm-hmm.
Kindle. And the audiobook is halfway done, but on hold because I've lost my voice with all
Right.
this thing. So I'll get back to the audiobook. It's halfway done, so it will be ready.
Cool.
And
Cool.
I think we will also come out with more versions of the book, like video
Mm-hmm.
content or
Yeah.
animated content, cartoon content, some way to make it easy to get
Mm.
the tough stuff, get it easy to use.
I love that. Yeah, me and my wife, we had started doing some animated stuff, and I told her, you know what, let's make some more of those. We want to reach everybody, that's how I got her to participate. We have to make her into a cartoon, so it's all good. So, but thank you. She has not read particularly the chapter on type 1, but she will be, and I'm really interested in her feedback. So I'll share that with you once we get to that. But I really thank you again. I'll be also, what I do in my clinic is I have recommended resources. You will absolutely be part of that. And we'll try to get more people to read something that's digestible and that they can impact change with. So thank you so much for the work you're doing, for
Thank
coming
you.
to the podcast and coming to the podcast not when you're not 100%. I didn't know that until the end. So I had no clue. So you did a great job in spite of that. So thank you so much as I wrap up. Okay.
Thank you. And if they like it, please go and review us on Amazon so the big tech
Please.
algorithms, yeah, you got
Yes,
to tell the
yes,
algorithms that this is a good book.
yes. We have to, just like on YouTube, there are certain things that we must do. But yeah, in fact,
Yeah.
I'll make sure to do that as well. So, but thank you so much, guys, for checking out this episode. We delved into the incredible world of managing diabetes through the lens of a low carb. Rather, you are dealing with type 2 diabetes or seeking better management for type 1, like my wife, the power of low carb cannot be understated. This message of hope is one that needs to be shared far and wide. The healing potential of low carb is truly remarkable and can make a significant difference in the lives of those struggling with diabetes. We encourage you, as I've stated earlier, in helping to spread the message about the effectiveness of low carb by sharing this wonderful book with friends and family, and together we'll help empower people to take control of their health and well-being. So again, thank you for tuning in. And remember, the path to better health may just start with a simple change in diet. Let's embrace the power of low carb living and help make a positive impact on the lives of all of those people around us. As we wrap up, I appreciate you and thank you for coming to this episode of the Protecting Your Nest podcast. And until the next episode, continue to be safe, be well, and continue to protect your nest.